Well, rapid antigen testing is now approved for private use as of November 1 in Victoria, but one aged care operator has already mandated the practice. Lou Paskuski is the CEO of TLC Healthcare. Lou, thank you for joining us. You've been very quick off the mark getting visitors to your aged care facilities using these tests. Why did you jump in so quick?
Look, once we saw the outbreaks that were occurring in New South Wales, Laura, we saw that ultimately double-dose vaccination was a great mechanism to minimise hospitalisation and the effects of COVID, but it wasn't going to stop outbreaks. So we mandated it across our 11 aged care homes back on the 9th of September, and to date we've actually had 8 positive rat test cases, which were all confirmed PCR positive, basically saving 8 outbreaks at our homes and maintaining our record of no COVID in the home for the last 21 months. So ultimately it's worked for us, and it's not something that we're going to relinquish anytime soon.
Yeah, literally catching COVID at the gate. Has acceptance been good from those who you're asking to get tested as they arrive at your aged care facilities?
Look, absolutely. Once we were able to convey the number of times that we'd had close contact cases, and basically been able to minimise its impact on the homes and visitation, it actually maintained open visitation at the homes. Our resident family members have been very complimentary with regard to their relative feedback and are supporting us, which is great.
It must have come at a bit of a cost to you, though. I mean, you have to have a qualified, at the moment, you have to have a qualified medical officer, a doctor or a nurse administer these tests at every single one of your facilities. Has that been a burden to you?
Look, no, not really. Obviously, with the high employment rates of registered nurses and ENs as well, we have them available to us. And look, to be honest with you, the cost of the nurse, the PPE, the test itself, the caravans, and basically the entire package, when you compare that to an outbreak and the ramifications of an outbreak, it's really a no-brainer. To be honest, it's just something we're going to have to bear in the future.
Have you had outbreaks before these tests were available in your facilities and been through what we have seen, horrible conditions when that happens?
Fortuitously, Laura, over the last 21 months, we have engaged infection control practices of the highest level, and we've been lucky enough, despite 75% of our homes being in hotspot areas, we've been lucky enough not to have one case in any of our homes over the last 21 months that's resulted in an outbreak. So not one resident has contracted it and died from it. Not one staff member has contracted it and brought it into the home. We've been quite lucky, and our efforts have really paid dividends. But yeah, look, I haven't slept too much for the last 21 months. It's been quite testing. But look, we're really happy of what we've achieved, and hopefully this is the last layer with double dose vaccinations as the catalyst. Hopefully this is the last layer that'll keep our residents and staff safe.
Absolutely. It has been a really trying time for aged care. Lou Paskuski, the CEO of TLC Healthcare, thank you so much for your time this afternoon.
Thanks, Laura. Thanks, Laura.